to learn about the MR anatomy of spine. So these are the different images T1, T2 and stir. So T1 means these are the different sequences of MRI. So T1 you can identify when the CSF is black. T2 here the CSF is white. In both the abdominal and the fat muscles appears bright. Whereas in stir the CSF is white with the abdominal and with the muscles surrounding that is the fat is suppressed, so it is dark. Now more images is T1 contrast. So just like T1, but you can see the vessels, that is T1 contrast. Diffusion weighted imaging, it is a ghost image with CSF black. Ghost image with CSF white is ADC. So in the spine MRI we are starting from the craniocervical joint. Craniocervical joint mainly consists of atlanto-occipital joint and atlanto-axial joint. So we will start with the anatomy of the atlas vertebra. So here what we are seeing is the anterior arch, the lateral mass and the posterior arch. So the anterior arch of the atlas, the posterior aspect of the anterior arch is articulating with the dens or the odontoid process of the axis vertebra. And behind this dens or odontoid process is the transverse ligament, which is attached to the both is the transverse ligament. So this transverse ligament is dividing this into anterior and posterior compartment. Now here is the lateral mass. In the lateral mass you have the articular facet, superior and inferior. So superior articular facet is to articulate with the occipital condyle and inferior is for articulating with the axis, atlanto-axial joint. Now here lateral to that you can see the foramen transversarium. So that is for the passage in this is present in cervical vertebrae C1 to C7, and from C1 to C6 you can see the vertebral artery within this foramen transversarium. So this in case of atlas vertebrae, this is where the vertebral artery is taking a loop and it is ascending upwards into foramen magnum. That means up to this the foraminal segment is the V2 segment of the vertebral artery. Now from here it is taking a loop, and here is actually in the posterior arch there is a groove for this vertebral artery, after which it ascends upwards into the foramen magnum. Now when we are looking into the ligaments, so here as we have already told, the transverse ligament that is behind the odontoid process, and this is actually part of a cruciform or a cruciate ligament, just like an shape of a X. Why? It is having two fascicles, superior fascicle attaching to occiput and inferior fascicle attaching to axis. So that is about the transverse ligament. And the other ligament is the alar ligament. Alar ligament means here will be the odontoid process. Now from the odontoid process, alar means towards the sides. So laterally running ligament from the odontoid towards the occiput is the alar ligament. Now when we are looking into the sagittal image, the same thing, here is the dens or the odontoid process. In front is the anterior arch of the atlas. This is the posterior arch of the atlas. So behind the dens or the odontoid process is the transverse or transverse ligament. Now from the apex of this dens or odontoid process to the occiput, that is the apical ligament. And from the atlas towards the occiput, if it is from the anterior arch, it is anterior atlando-occipital membrane. If it is from the posterior arch, it is posterior atlando-occipital membrane. Now over the spinous process is the supraspinous ligament, and the cephalic extension of that is actually called ligamentum nuchae. Now other one is just behind the transverse ligament. So along the vertebral body and the intervertebral disc. If it is on the anterior side, it is anterior longitudinal ligament. Posterior side is posterior longitudinal ligament. So this will be anterior longitudinal ligament. Here will be the posterior longitudinal ligament. This posterior longitudinal ligament has got an cephalic extension called as membrana tectoria. So this image is the coronal image. This is the showing atlando-occipital joint. So you can see here the dens or the odontoid process, and this is the atlando-axial joint. Now this image, what we are seeing, this is the dens or odontoid process with anterior arch, posterior arch. Here is the transverse ligament, and this is the posterior longitudinal ligament extension, membrana tectoria, the apical ligament, anterior atlando-occipital membrane, and here will be the posterior atlando-occipital membrane. Now the spinous process of the vertebrae. So the supraspinous ligament extension cephalic called as ligamentum nuchae. When you are looking at this image, here is the odontoid process. From the odontoid process extending laterally towards the occiput, that is the LR ligament. So this ligaments become visible if there is contrast in the background. If there is some fluid or blood in trauma, it gets more visibility. Now so what we told is about the initial cervical vertebrae C1, C2. When we go down C3, C4, C5, C6 and C7, in that level the vertebra has some change. That is, they will be having a vertebral body and a hook shaped bony projection called as uncinate process. It is for angovertebral joint. This is articulating with the adjacent vertebra to form angovertebral joint. Now the foramen transversarium will be there, and these are the facets, that is superior and inferior articular facets for the facet joint or zygoapophyseal joint, and then lamina joining to form the spinous process. So when we are looking into this axial section image, this is the vertebral body, and the anterior end is the anterior longitudinal ligament, posteriorly is the posterior longitudinal ligament. So this is the groove, the foramen transversarium, this black color, and we have this facet joint. We can see that line for facet joint between superior and inferior articular process, and then comes the lamina joining to form the spinous process. The thecal sac is having the spinal cord inside. Now in front of the lamina running, that ligament is the ligamentum flavum. If we are looking into this image, here will be the clivus. This is the dens or the odontoid process, and this is the anterior arch, and this is the posterior arch. So behind the dens is the transverse ligament. From the apex of the dens to the occiput is the apical ligament. Anterior arch of atlas to the occiput is the anterior atlando-occipital membrane. In front will be anterior longitudinal ligament. Now like that, from the posterior arch to the occiput is the posterior occipital membrane. So behind the transverse ligament you have the posterior longitudinal ligament extending above, that is membrana tectoria. Now the spinous process. The supraspinous ligament is having a cephalic extension called as ligamentum nuchae, and in front of the lamina of the vertebra is the ligamentum flavum. Now this is the vertebral body. This is the intervertebral disc. The part of the vertebral body which is close to that is the end plate. Superior end plate, here is the inferior end plate. So this is the spinal canal having the spinal cord. This is actually the subarachnoid space. You will be having the dura. Sometimes you can see the epidural space. These are the things what you can see in this image. Now this is another axial section image showing the, it is showing actually this is the cervical vertebra level. It is showing the groove for cervical. This is actually the image of atlas anterior. This is the dense or odontoid process. Inside it is the lateral mass and the foramen, the pedicle and the lamina and the spinous process. So here what you can see is the groove for the vertebral artery, the transition from V2 to V3 segment of the vertebral artery, When you move into the thoracic vertebra, the similar things only, that is vertebral body, intervertebral disc, anterior longitudinal ligament, posterior longitudinal ligament, the spinal canal, ligament of flavum, spinous process, supraspinous ligament, interspinous ligament. Here we can see the dura. So above that is the epidural space. Epidural space mainly has fat and also the Batsen's venous plexus. Now when we are taking an axial image in the thoracic section, here is the vertebral body. So after that we have the pedicle. So this is the pedicle and pedicle transverse process. This is the lamina and the spinous process. Now here is the facet joint or zygoapophyseal joint, that is between the superior and inferior articular surface. You can see the facet joint on either sides. So here will be the anterior longitudinal ligament, posterior longitudinal ligament. Here is ligamentum flavum, and this is the spinal canal. The thecal sac is having the spinal cord. These are the paraspinal muscles. In cervix it was mainly like semispinalis, planius, capitis and all. Thorax muscles name I don't know. So here what you have to remember, this is the rib. So here the rib is articulating with the vertebral body, that is costo-vertebral joint, and rib is articulating with the transverse process called costo-transverse joint. Now this image is actually, up to this image the pedicle was not visualized. So I want an image to show you the pedicle. So that this is the neural foramen. The neural foramen is bordered by anteriorly the vertebral body and intervertebral disc, and above and below you have the pedicle. Behind is the superior and inferior articular process. So this will be the neural foramen. So that this is actually a case of a lumbar, a sagittal section of a lumbar vertebra. The vertebral parts and everything will be is just like same only. Vertebral body, disc, supraspinous, interspinous, a ligament of flavum, anterior longitudinal ligament, posterior longitudinal ligament. When you look into the spinal canal, up to that the spinal cord is having a tapering called as conus medullaris, after which they continue as nerve rootlets, that is cauda equina. So that we can see here, and this is at the level of the disc L1 L2 vertebral disc. Now when we take a axial section, vertebral anatomy is almost the same, but when you look into the spinal canal, we can see the arrangement of the nerves is together here. So that is conus medullaris, after which we are seeing the nerve rootlets. So that is the cauda equina, and the remaining is same, the intervertebral disc. You have the pedicle, the transverse process, lamina, spinous process, the facet joint or the zygoapophyseal joint. In both sides it is the same only. Now when you are taking a pictorial representation of that, in the vertebral body is the outside annulus fibrosus and inside is the nucleus pulposus. Now here we can see the pedicle, the transverse process, the lamina and the spinous process, and here is the facet joint between the superior and the inferior articular process. Here we can see the thecal sac, inside will be the spinal cord. So this area, this is the central canal region, the central region, and this is the lateral recess region. Close to the pedicle and the facet joint is the lateral recess, and then you have the neural foramen. So this is important to know that there will be something called exiting and traversing nerve root. So the traversing nerve root will be in the lateral recess, and the exiting nerve root will be in the neural foramen. Here we can see the exiting nerve root. So this is the part of the intervertebral disc. Annulus fibrosus outside, nucleus pulposus inside. Nucleus pulposus means there is no vessels at all. The vasculature, it is getting by the diffusion from the end plates of the vertebra. Now here this is actually zones. The same thing, which the extension of what I am saying right now is this: the central zone, the lateral recess, the intraforaminal, extraforaminal zones. These are important, especially the lateral recess zone, because most commonly this is the central, this is the lateral recess or the paracentral. So most common herniation, disc herniation is in the paracentral region. So who is here is the traversing nerve root. So it is getting affected. The exiting nerve root is here. So what you are seeing in this neural foramen is the exiting nerve root. So near to this neural foramen will be the dorsal root ganglion. Okay, this image is actually showing the mid-sagittal section. So how to know it is a mid-sagittal section is the width of the spinal canal will be maximum at that region. Now when you are going peripherally, that is in the parasagittal section, the width of the spinal canal will be less, and you start to see the traversing nerve roots also. So that is how the two images are different. Now to just say about the spinal nerves. So actually we have got 7 cervical vertebrae, but 8 spinal nerves are there in the cervical region, and thoracic. So we have the 12 thoracic vertebrae. So we have 12 thoracic vertebrae and 12 thoracic spinal nerves. And regarding lumbar, 5 lumbar vertebrae, 5 lumbar spinal nerves. So that is corresponding. So what we are seeing here is 8 cervical nerve roots, but only 7 cervical vertebrae. So the initial nerve root is arising superior to the corresponding vertebra through the intervertebral foramen, superior to the corresponding vertebra. If you are taking C3, C4, who is going, the C3 is going above the C3 vertebra. Between the C3, C4 vertebra is C4. If you are taking C6, C7, who is going exiting, that is the C7. C7 is exiting. So C8 will be going below the C7 vertebrae. Now when you are taking the remaining, that is thoracic and lumbar vertebrae, the exiting nerve root will be inferior to the corresponding vertebra. Inferior to the corresponding vertebra, because here C8 is running below C7. Now if you are taking T1, that is below T1 vertebrae. If you are taking L4, L4 will be below the L4 level. So if you are taking us in a cervical section, C6, C7, who is exiting is in between C6 and C7, C7. But if you are taking thoracic T6, T7, who is exiting T6.